I'll try not to be as angry as I was earlier today, but actually I am seething underneath. I'm sorry if I don't really get your name of the last speaker. I really do apologise. But you said that disabled people need to be open to more change. That's an extraordinary challenge to say to us. Under the directives 2002, the Barcelona Accord, and also 2012, the report, the United Nations, the European Union have all said disabled people have a say in how they conduct their lives. Every single directive, practically since the beginning of disability movement, says that we have an equal right in our say in the way we live our life and how we direct the change for our life. Now, when you come out with a statement of disabled people need to be open to more change, the first thing I think the government and also the groups that look after and care for disabled people is you need to think that the disabled people actually need to be the voice at the centre of their own care, which actually is in practically every directive since the disability movement began. At the Barcelona Accord, the patient, the client, is at the centre of their own care. And we have then a person from social protection say disabled people need to be open to more change. Disabled people need to be there and to be listened to and to be the centre of any change.
I really just need to reply to this because I think I'm being misunderstood totally here. First of all, I'm not from the Department of Social Protection. I'm an independent operator. No, I'm just, there's not, you don't need to apologise. I just want to explain that. I am totally in favour and have a track record of being totally in favour of people with disabilities determining their own future. So I absolutely 100% agree with what you're saying. The only change that I was saying, that I was talking about, was the resistance to any change in the income maintenance system that ends up with somebody losing some money. Because the income maintenance system as we have it is not fair. It is, some people are getting an awful lot more than other people, and it needs to be rationalised. So that's all I'm saying. I'm asking not just that people with disabilities, but all recipients of the social welfare system would be open to changes which will mean that some of their members would lose some money. That's all I'm asking for. I am not suggesting for 1 minute that you would not speak out for yourselves. Of course you should. Similarly, when I was talking about the individualised budgeting, I'm totally in favour of the individualised budgeting packages for people with disabilities. I was merely expressing the caveat that there are some people who are not capable of managing large amounts of money. And I'm a lawyer myself, I am aware of quite a few cases of people who did get money through the court system and all the rest of it, and who were utterly exploited by other people. So all I'm asking is that if individuals with disabilities are to be allocated individual budgets by the HSE or whatever the service provider, that the capacity legislation should be in place first so that there is a protective system for people who do not have the capacity to manage their budgets. There's no question or doubt that people with physical disabilities have full capacity. Some limited number of people with intellectual disabilities don't. And that's the only area that I'm looking for protection in.
Well, that is stopping the Charter for Human Rights. And it is a stalling tactic to me. They don't want to change the Lunacy Act. They don't want to work on it. You know how fast things go in Ireland. I'll be dead before half the changes come in.
I have been active in promoting the capacity legislation. I wrote the Law Reform Commission booklet on the subject. I wrote a booklet for Inclusion Ireland on the subject. I've been promoting it for years. I agree with you that there is a ridiculous delay in enacting it. I fully agree with you. But I still think a level of protection is required for some people because I have seen too much exploitation of people. And I'm not incidentally concerned about the exploitation of the state. I'm concerned about the exploitation of individual people who don't have the capacity to make decisions for themselves.
Hello, can I come in?
I have been on discussion with the capacity bill myself. We're trying to fight for it all the way through, that anybody with a disability should have a right to have a relationship, the right to get married. I think it's a disgrace. We should be allowed to sit around the table with our own delegations of TDs and the government to tell them what we want, not what they want. It's our voice. We should be heard, not put down. And I think today and the next couple of weeks that our voices should be heard. And I agree with what the first speaker said. Let's get it on. We need to get up there and be heard. Thank you.
Yeah, thanks very much, Brian. I'll just let each speaker chance to respond at this point. Do you want to, Isa, do you want to respond again?
I think I've pretty well said what I was going to say. I think the reality of there was a reality about medical cards as well that I think people have to face, which is that medical cards were very significantly handed out and for political reasons, and all you have to do is look at the political map of the country and look at the percentage of medical cards, and the disproportionate percentage of medical cards in certain parts of the country, and it doesn't take very much to figure out why there's a disproportionate amount. So in fact, while the exercise to rationalise medical cards may have been carried out with less than the best possible attitude to people, and I accept that it was, it nevertheless did have to be done in order to ensure there were an awful lot of people with medical cards way above the income limit who did not have any particular illness. I mean, we just have to face the reality that was what was there, and it's this is the problem. Once you try and put right, just because we did things one way in the past doesn't make them right, and trying to put them right inevitably causes some problems. And I accept, as I say, that the process was not carried out with the degree of sensitivity that it should have been carried out with, but nevertheless, I still think it should have been done, and people who were not entitled to medical cards shouldn't have them. Otherwise, I think and I think the same is true of any group. It's nothing to do with people with disabilities per se. All the people who are unemployed, for example, don't want any change in their payments, even though it might be a better thing for everybody if there were changes. So I just think everybody has to be open to make changes, and it's a reality that's going to happen whether we like it or not.
Hello? I mean, I think that the conference here today is about the cost of disability, and I'm just wondering about when we talk about rationalising and reviewing and even individualised supports, etc., that are we not doing it in a vacuum to some degree because we don't know the true cost of disability? And is there not an argument for saying, like we had the talks this morning about and rather than getting into figures or amounts, that possibly over 30% difference in terms of the cost of disability to a household than a non-disabled household, so there's a significant additional cost, and people here and everyone else we've spoken to about this over the years can account for a number of additional costs. So, and I want to ask Claudia something related, but maybe after you answered, in that, so is there not policy making in a vacuum at the moment? Because we're talking about rationalising, tidying up, mainstream, needs-based, etc., but we actually don't know the true cost of disability, or we don't have a handle on the true cost of disability. And so is there not a rationale for maybe a commission on the cost of disability to look at to try and capture the true costs as part of informing the reform of social welfare and the various systems, etc.?
Well, I think I did start out by saying that I thought there were three areas that we had needed massive coordination, and that was within social welfare, between social welfare and the health services, and between social welfare and taxation. And that's exactly what I agree. And within that should be done. And then within that, if you had an individual assessment, a proper individual assessment of needs, then you could decide on an individual basis what the need was, what the need for income maintenance was, what the need for health services was, what the need for specific, physiotherapy, OT, etc., special needs assistance, whatever, what the individual needs were. I don't think you can I don't know that you can arrive at a cost of disability that is a general cost. I think there is a cost for each individual person with a disability, and it's somewhat different. And the only way that you can assess that cost is on an individual basis. But you then need to be able to respond to that need with a coordinated set of income maintenance and health and other services. So that's the sort of model I was trying to say would be the way to go forward.
Just maybe just to also say, I don't think it's in any way, people with disabilities, we're not afraid of change. Change is all our lives, constantly, every day. I think it's a bit unfair if we agreed something like the fact that if you could take up a job tomorrow without losing anything, including your DPMA, and over a period of 3 years, you can experience work and then come back for evaluation and go for the taxes and things like that. Yes, because at the present moment, trust has broken down. And why has trust broken down? Because of promises after promises of doing something and at the same time being left outside of society, left outside of the planning, left outside of being part of any kind of mainstream, despite of the policy of governments, etc. And I'd say, let's do it. Let's go for it. 3 years. Give anybody with a disability who has a medical card, who has a disability allowance, let them keep it. Go out and get a job. And anything you earn, you pay taxes on it. And at the end of 3 years, you're up for review. Right? And then you'll have the experience of whether you want to go back and so forth or not. And let's do a decent thing as well. And the people who have a disability and through no reason other than illnesses or because of disabilities, etc., who will never work. Now let's stop. Let's give them something real that they can live on. 188. How could we possibly trust anything when we've been kind of subject to that kind of life all our lives? And so let's put something out there that we can trust and we can build on.
Just as a matter of fact, if you are on a disability allowance, you do go back to work, you can retain your medical card for 3 years. That is part of the system.
That was changed in the last budget, Ita.
Sorry?
It was changed in the last budget.
And Ita,
you can keep a GP visit card.
That's right. Sorry, I beg your pardon. You're quite right. Yeah.
Let me tell you something else. Nobody lost their medical cards, right? It was taken from you. You didn't lose it. It's very negative language and somehow or other that we're responsible for that. It was removed. It was taken away. Your disability wasn't taken into account. It was ignored every kind of way. We know. And just in case governments don't know, they should have learned something last May. And those kind of things. So that's the reality in the practice.
Thanks, Martin. I think we have to wrap it up, so I'll just ask Claudia to say a few words in response before we...
Claudia, just can you hear me, yeah? One of the things you were saying was that because of the stuckness of government in terms of not changing income on the income side for people with a disability, that your campaigns or people with disabilities are looking at how they might affect the cost side, and market costs, etc. And I suppose my question is around from an organisation like Inclusion Ireland, which endeavours to campaign on these things, that it will be a worry to take responsibility for trying to affect what are basically market-driven factors in terms of the cost people pay for various items, etc., and to take the pressure off on the income side, which is a responsibility of the elected public system,
The system is so different in the UK. Some of the comments I've heard is I'm actually quite shocked at some of the things that happen. And so I was sort of totting up what disabled people get in the UK. If you are disabled and out of work, you get roughly €240 a week. If you are, which is more than here, obviously, If you are disabled and in work, you get €102 a week. But if you are disabled and in work and that's an average, but if you are significantly disabled and go to work, you get €140 a week. And that is in compensation for the fact that your life is more expensive. So it's not means tested. If you're in work, you can be earning £100,000 a year. It doesn't matter. You will still get that money as a recognition that your life is more expensive. Having said that, things like personal budgets, you're talking about individual payments. We've had personal budgets in health and social care for about 20 years now, and they've been rolling out since then, and a lot of people do have them. Because we have two different payments. We have payments for disabled people who are unemployed, and then we have payments for all disabled people, regardless of employment status. But we don't have all the other additional kind of pensions and bits and pieces so much. We tend to just have those main payments. Having said that, you would think how disability lobby is therefore very effective in actually getting more for themselves. This government has seen that despite the levels of being substantially higher, 34% of people who were previously receiving the unemployment disability benefit are now found fit for work, so have their benefit completely got rid of. That's 34%. And 20% of those who were getting disability living allowance, which is the unmean tested one, have had it cut as well. So you've now got potentially upwards of a couple of million people in the UK having their benefits completely stopped over the past 5 years. They can fall back on job seekers allowance, they can fall back on generalist benefits, but all their disability recognition has gone. And with that, all the passporting to adapted vehicles and all the additional stuff they might get. So because of that, there has been a hell of a lot of protesting, lobbying. We've seen people lining up, chaining their wheelchairs across Westminster. We've seen some real strong pushes on that. And there have been some wins. There have been some sort of clawbacks and some U-turns that have been made. But I think what over the past 5 years of struggle, people are realising is that, and this is getting to your point about cost versus income, is that something that is potentially a kind of more sustainable agenda and is potentially more empowering is to say to government, okay, you're not going to give us more money, but actually this money was your apology for the fact that your houses and your transport and everything that you're building, your public spaces aren't accessible to us, your workplaces aren't accessible to us. We need you to invest in, the next time there's a big commission for London buses, why are they not all ramp enabled out of due course? That should be standard design. So it's seen as quite an enabling thing that actually people are trying to look at long-term investments. So there's a big campaign at the moment to make sure that all the new housing that the government has pledged is built to adaptable standards and wheelchair accessible, so that actually a lot of the costs that are associated with living with disability would be designed out at the earliest stage. The idea around the private markets, which is slightly different to housing and transport, the private markets of phones, clothing, food, specialist stuff, is actually the disability lobby coming together and saying our purple pound, our disabled pound, our consumer clout is actually worth a hell of a lot of money. There's a lot of us. And if we're able to push together, we can say these markets have to respond to our money and actually have to start designing products that meet our needs, not just older people. Because in the UK, everyone talks about the grey pound or the pink pound. No one's talking about the purple pound, which is the disabled pound, as a consumer force. So while I don't think the fight around income welfare reform has been given up, I think people are now looking at the kind of more sustainable, long-term reduction of the costs of living with a disability, simply because we know that even the next government, if it's a Labour government, will still have to look at the deficit and still not be able to do a huge amount with the welfare state right now.
I'd just like to thank all the speakers, Dr. John Cullinan, Dr. Dorothy Watson, Michael Taft, Eileen Daly, Claudia Wood, Martin Knox and Dita Mangan. A conference like this, the quality of the speakers essentially makes it, and the quality of the speakers here today has been excellent. And the audience reaction, I think, has been the other factor. And the way I'd wrap it up is say, look, we talk about all these things. It's to make the better reality is the trick, is what we're about. And, it's very depressing, really, when you think about the capacity legislation being so long and trained. I know Ita has done a lot of work on it. I know Maureen McCartney here has done an awful lot of work on it. A lot of good people have done a lot of work on the capacity legislation, and still we haven't got it. Like, we have policies, but let's bring them to reality. And I'm inclined to agree with Martin that the poll and the numbers in the election is probably the clearest way to signal, because politicians fear for their own future in terms of the numbers, and that's the only button we can press with them, you know. So I'll call the meeting to a conclusion at that. Yeah, thank you. Thanks very much.